Hello and welcome to a new episode of Etc. Podcast, where we disrupt the taboos in medical tourism and bring in guests from inside the industry, from insiders to insiders. And today we have a very special guest with us, a guest who graduated from diplomatic interpretation and translation from Algeria, a guest who has worked as a translator, as a sales agent, and then found her passion in aftercare. A multilinguistic guest that is native with 5 languages and in the learning process of another 3. Help me welcome our beloved guest for today, Rania Abbas. Rania, thank you so much for joining us today.
Thank you, Rania. Thank you so much for the invite. I've been watching your videos and I've
we're so
really
happy.
liking the concept.
We're so happy that you are among our audience. And Rania, let me kick off things by a question of what brought you into medical tourism and more specifically into aftercare?
Well, as probably you have all the comers
People,
or the guests that you have invited
uh-huh.
here have mentioned, it's out of coincidence. It
Yeah,
was by chance.
All of us.
Coincidental,
Yeah, I believe
accidental.
so.
Yeah.
Exactly. So I was looking for a job and I wanted something different, but yet closer to my career path. Also, that relates to the skills, linguistic skills that I have.
Yeah.
Therefore, I was looking and came across medical tourism. It was a really good position, so I thought, why not give it a chance?
Yeah, that's a story of
Perfect.
everyone, basically.
Absolutely, absolutely. And I first started as a translator and interpreter, more appropriately. It was an amazing. It was an amazing journey, definitely. But then I felt like I wanted to do more than that. I wanted to,
Extend the conversation
exactly.
with patients.
I wanted it to be more than just interpreting to a certain time.
Just in the
clinic, and I wanted to go beyond that.
Yeah.
Therefore, I felt, why not try aftercare?
Yeah.
And actually, I like it because I'm a person who likes helping other people. I really enjoy this, and it's really effortless for me.
Yeah, that's phenomenal. Aftercare requires a lot of empathy, requires a
Absolutely.
person who cares, who loves to help
patience.
others. And speaking of which, just for our audience to know, Rania speaks fluently Turkish, Arabic, English, French, and Spanish. I couldn't be more jealous, Rania, to be honest, but all of us. I would love
Oh, no.
to know more. When you contact patients from all of these languages, you are connecting with different cultures. Can you give us more into this experience?
Well, to me, speaking different languages, first of all, it's a mean of communication. Yeah, you all know that you have to interpret or, let's say, speak from different codes or convey a message from a different language to another. But then it doesn't stop to here. You have to learn about the culture that relates to the language.
mindset.
Exactly. See the mimics, understand how people react to things. And it has happened to me personally, whether when I came to Turkey or when I went to somewhere else, like France, let's say. I had to adapt to people's reaction and behavior, let's say, in order to extend my understanding.
I've noticed this, for example, even in Turkey, when we are foreigners. So when we first learn Turkish, some words have a stronger meaning than others.
Absolutely.
Yes, some words can raise different questions for people. So as foreigners, we need to learn more about the culture of the language we're
Absolutely.
learning. So kudos to you for not only knowing 5 languages, but knowing 5 different cultures.
Thank you so much.
That's phenomenal. And, most people think that aftercare is about fixing problems. Aftercare is the one that talks to the patient when there is a problem and they fix it. But I'm positive it's more than this. What is the real purpose of aftercare?
Right. So, that's true. Many people think that it's a complaining department. It's just about fixing problems. But I think it's just beyond just that, It goes to connecting with other people, to really understanding their concern. These are, after all, people coming from a foreign country. They don't know much about it. You have to feel them.
Yes.
We can't feel them for real, but we try to understand their concern at least, be in their shoes.
That's empathy. That's empathy.
Absolutely, absolutely. So maybe they have these problems that you need to fix for them, but that, after all, you're exchanging a service. They came here for a treatment. You have to follow up with them. You're not going to, throw them away or, just ghost them. That's the word I was looking for.
Ghost them, yes.
A lot. Many people have have committed many, let's say, mistakes when it comes to the results. They were like shocked about it. They didn't really accept it. They were refusing it, and there was no one to head on to talk about it. So this is unfortunate.
So beyond problems fixing, do you agree that the aftercare department is a huge representative of the brand itself?
Absolutely. It is. It goes hand in hand.
Yes,
It goes hand in hand, because if you're as an aftercare specialist, I am at the same time being a professional and caring about people, growing this trust with patients.
This translates into the company being professional.
Yes,
this
definitely.
translates into the clinic being empathetic.
Of course, because I'm showing it.
You are the representative of aftercare.
Yeah.
Choosing your words carefully, like when you're speaking with the patients.
Absolutely.
To not
That
take
is
these
very
words
critical.
and like do some profit.
It is critical. We get a lot of patients from all over the world, and with different background, different level of education, let's say. Some of them are very triggered by some words, and you need to adapt to that.
We have the manipulation ones.
Sorry?
The manipulations.
Oh,
Yeah. And,
absolutely.
and speaking of which, working in aftercare means you have seen the best of the best and the worst of the worst in terms of cases. And whenever I talk to aftercare specialists, they always have that one unforgettable case. And can you share with us an unforgettable case, and how were you able to overcome it?
Actually, I cannot really sum it up in one story, but it's ongoing. I can tell you about situation that I've been through. Let's say it didn't happen to one of our client personally. I mean, not in the clinic, or at least I have met this person in the mall, Apparently this person, for real. This person was shopping, but this man had obviously had a hair transplant, and his head was swollen, it was red, he had an infection going on. And I was like, I wanted to reach out to him. I wanted to tell him, please, don't do it. What are you doing? I couldn't, unfortunately. He disappeared somehow, but it stayed in my heart. I was like, I wish I could do something about this. Unfortunately, I couldn't.
Rania, caring even
outside of work.
Of the aftercare department. This reminds me also of once I was on the beach, and I saw a patient who had a hair transplant.
No way.
On the beach
Always
in the
telling
summer.
them not to do this.
What are you doing? Like, the only thing inside of me was, what are you even doing here? His hair transplant is so fresh.
And they can after that complain about this.
Exactly.
Yeah.
Not sticking to the instructions, not following them up, but then after the results are, the healing period is done, they get back to you, they tell you, they blame you for it. But then when you explain it to them, they end up really
a lot of them will
understanding
have
it.
tantrums. A lot of them will become angry, which kind of brings up the question, like, how do you handle the tantrums of patients, the angry patients?
Well, the angry ones, yeah, of course, there are way too many.
I think, exactly. I think they represent a very
way too many.
high percentage.
Yeah, it goes in different surgeries, I would say, and in different procedures. They have this kind of attitude, and they come to you and they unleash their anger about you, on you.
Yeah.
But the best remedy for this is to go along with them.
Okay.
Agree.
Okay.
Validate their complaint.
Exactly.
And then when you gain the trust, they can okay, you understand it. Okay, I understand that you understand it. All right. Then they start following what you say step by step. It's like shifting their anger to, conveying with you.
Yeah.
This is how it goes.
Through from this question, I have been seeing aftercares that apart from your job is to solving the patient's problems. And this have full of causes, conflicts. Yes. How you motivate yourself to keep calm and chill, to not affect
Great question.
you
Absolutely. It's an amazing question. Because this is a real challenge, right? Because we meet a lot of tantrums, as you said earlier, and we meet a lot of patients who at one point you tell yourself, what am I doing? Why do I have to solve everybody's problems and be there for them and try to understand it? Why nobody understands my problems?
Exactly. Yeah. It's like the therapist who needs a therapist.
Absolutely.
And you see employees coming to you like, it's like, I have a problem with this patient. Can you speak with him?
Can you please talk to them?
Push from the employees.
It's an ongoing kind of thing. You see, whether at the clinic, whether at home, whether I'm outside. Sometimes when I'm cooking, at the time talking with patients. You should do this. Don't worry, everything's gonna be all right.
Yeah.
But the truth is that sometimes you get to a point where you cannot go further. You just have to give yourself some time.
Yeah.
Rest a little bit.
Yeah.
Much needed. Put your phone aside because, as you know, we have a phone that follows up everywhere, 24/7. You have to keep, following up with patients, especially those who you cannot meet in real life. Because I have to meet them sometimes. But still, I really put myself in their shoes. I just tell myself, what if it happened to me?
Yeah.
What if I go to a different country and I get the procedure? And then I don't know anybody. I don't even know the language. Nobody can respond to me. What do I do in that situation?
Rania, let me tell you something. I never worked in aftercare specifically, but I got the chance to work in some clinics who didn't have aftercare department, which means that the sales agent was the one who's taking care of them.
Big mistake.
Yes, I totally agree that it's terrible if you don't have aftercare, but I just want to shed the light on one point that you said. You said that point in so many different ways. Patients just want to be listened to.
Absolutely.
Especially the ones that are angry, especially the ones that are throwing tantrum, they just want to be listened to. If you listen to them, they will calm down.
True.
Massively, you know?
True. I have seen it multiple times.
So kudos to you for doing this phenomenal job and at the same time holding it together with all of these complaints.
It is really hard sometimes, but I cope with this. I got used to it. And especially those angry ones. Sometimes I understand where this anger is coming from. It's because they don't have any solution and they need immediate response sometimes.
Yeah.
They only have you.
Yeah,
outside of the complaints, outside of the brand image, I think some clinics or some decision makers care most about revenue streams. So they want the revenue stream to be stronger. And I'm a firm believer that aftercare is a huge reason for reference increase. To increase
100%,
references in the
100%.
clinic. Can you tell us more how does it relate to references and increasing the business?
Okay, so let's say you have a patient who came and had his treatment, whether hair transplant, surgery, plastic surgery, or dental treatment. They go back home. You're following up with them. You have to follow up with them. Why? Because when they find this responsiveness, once you're responsive to them, when you answer their questions, you're always guiding them, telling them what to do, what to not do, be there for them in case they want to use a certain product, in case they have a question about anything. Sometimes it gets to a personal thing, of course. Yeah. But without that, after setting boundaries, of course, once they see that this treatment is good, they find the responsive, they are cared about. They gain the trace. You have that trust. So they automatically, not even effortlessly, I would say, they would tell you without even asking for it. I have a friend who wants to do a treatment.
Friend, a relative,
a friend of a friend, a
neighbor,
sister,
a
brother, a colleague. Yeah, it goes on like this. Absolutely, it happens to me way too much. That sometimes I'm like, okay, you need to talk to your sales agent, because
so you have a huge part from attracting references from the patients.
And this is all due to what, or thanks to what? To the responsiveness, to the availability. Exactly. Because you're there, you're telling them what to do, and you're giving them actually solutions, not just, shut them up. But I think this is really important. This is really essential.
I have seen a lot of sales reps, they're losing references because they know aftercare.
Absolutely.
Yeah.
He said, I don't have time to speak and say their problems. You need to have time, but we understand the pressure on the sales reps.
And the sales agent as well, their main purpose is to make sales, right? Exactly. So when that's a dilemma actually. The more sales they have, the more aftercare they have to do, the more their target increase. So it's super chaotic if you don't have aftercare.
It is. I don't understand how clinics go without even caring about having a department of aftercare. It is essential, not only for their image, but also for their revenue. It goes on. It goes back to them from different perspectives. Good, it's prosperity.
So,
as an HR, when aftercare request and a leave, I give them directly.
We deserve it.
Because I know what I have been facing.
We need it. Because, even when they leave, when they are home,
they keep thinking about the problems.
Not only about it, they keep on talking to them on the phone. It follows them everywhere.
So for anyone who's watching, aftercare has so many important points. Like from a humanitarian point of view,
yes.
You are, since you are a service provider, you're entitled to help these people.
Yes.
That's number one. Number two, your brand is represented by how good of a follow-up you have.
Yes, of course.
And number three, even if you don't care about the first two, number three is you'll have more references.
Absolutely.
Right? That's more business. That's more patience, right?
It keeps on going.
Aftercare is so essential in all clinics. And it should be, there should be more investment in aftercare.
That's what I keep saying, but unfortunately in the clinic that I previously worked at, it was not available. It wasn't available. Many people got complaints and complained to their sales agent, and they were pretty much everywhere. I understand their job is not to follow up with them. And
this will affect on the reviews.
Yeah.
You see bad reviews.
That's what I was going to say. Actually, they got way too many reviews that nobody's responding, nobody's caring about us. Okay, we had a treatment, but there is a period of healing that needs to be supervision.
Yes.
Yeah.
And this is a very fantastic point for bringing on the table. Daniel Pink, in his latest book, To Sell is Human, where he talks about how sales shifted through times. You see, 20 years ago, customers used to buy from sellers, but now he says customers buy from customers. Now, what does that mean? It means that when you open Trendyol or Amazon or any website, you want to buy something, the first thing you check is reviews, right?
Reviews.
The first thing.
Absolutely.
So aftercare is so essential because aftercare is responsible for how much of a good reviews you have, the number of reviews you have, right?
Absolutely.
So speaking, what is an advice that you would give to managers or decision makers in this field about aftercare?
Okay, so we all know that this misconception is ongoing whether for clinic owners or for some managers, I would say. They think that it's a complaint department, that they don't want to get involved in that. Why would they get these people complaining about or having to solve their problems? I think they should think beyond just solving problems. They should think about the good side of it. Let's see. You see, as I told you, references, good image.
The brand.
These are mainly what they are trying to do.
Exactly.
And this is the very essential, or let's say the most important department that can have both of these at once and can, make it easier for you to get a very good image, whether online or even in real life. Yeah,
word of mouth is very important.
Absolutely.
As well. Forget the reviews.
It goes from
word
mouth
of
to
mouth
ear.
is so good. It's the most important thing you can have as a business owner, right?
Even if you have bad reviews, it's good to see that there's someone replying for this bad
Yes,
review.
I absolutely
all
do
the places have bad reviews, of course. The best doctor could have a bad review, but who's responding for this bad reviews? There's someone listening to this or seeing this even.
There are always going to be negative comments. People are hard to please. That's what I can say because I have dealt with many people. I have seen many people in real life, whether outside of work, and it's really nearly impossible to please them. So there's nothing perfect. But once they see the comments, and at least they see the bad comments as well, as you said, Amar, they would be, okay, we can, at least this is true. They're not lying to us. They're not buying the
For me, if I
comments.
check any website, if I didn't see any bad reviews, this suspicious. Something absolutely will not make everyone happy, but there's some people, they may not have the same
responsiveness.
And Omar, there's something that I personally do. I think you guys might be doing it or not, but when I check a business and check the reviews, if I see a negative review, I read it, then I see is there a reply or not.
Absolutely.
Even if there's a reply,
if something happened,
I feel like the truth could have a third face. Maybe this is one, this is two, maybe there's a third face. But when there is no reply, I know for sure that it is a bad thing, you know?
The
Yeah.
reputation could affect a lot.
Yeah, absolutely. Nobody would come to a foreign country and have a treatment and go through all
Without
this.
being comfortable for
Yeah.
this.
Yeah,
without
exactly.
without trust in it before even deciding to come. And we get many, for example, I have patients. I deal with them every day, and still they want to make retouche, for example. They want to have, okay, I want to change a little thing. Okay, can I have this? Can you this? When you don't respond to this, you already lost many patients. Not only you lost them.
A sales agent would never respond to
They
such a
wouldn't,
case.
they
would
wouldn't.
never. I promise you.
It's gonna take a long time, and especially for plastic, I would say, because it's mostly women, and women like to speak a lot.
Yes.
And they have long messages. They want to explain to you exactly what they feel, what they want. So this takes time, but once they find someone who actually listens to that, they would trust you. They would give you everything. They would come blindly.
This is what we want, right? This is what we want.
Absolutely.
This is the purpose of aftercare department.
And I should add, even if the results are not matching their expectations, they would still come. They would still come because there is someone who is there to help them in case they don't like it.
Exactly. Even, just like you said, aftercare can even bend the metrics of the result, because when aftercare listens very well, speaks very well, it can convey points that the patients did never even think
Absolutely.
about. And sales agents, I guarantee for you, would never make that effort. They're just focusing on new sales.
I believe that, it's like a bridge, you see. It goes from the patient to the salesperson. They start building this bridge. They communicate with them. They spend time with them. They explain to them everything. And once they have the treatment, they want to get the same attention.
Exactly.
And that's where my role comes. I need to be
make
there.
the bridge stable.
Yes, exactly. That's what gets back to the clinic's image on a very positive way.
We've seen this a lot. We've seen this even in reviews on Google. They took very good care of me.
Yeah.
They were communicating with me. When I paid, no more care, right? No more. They don't care about
I
me
even
anymore.
get it from many patients, especially for hair transplant patients. They say that for previous, experiences, they say, I've been there, I've done this for different clinics, and nobody afterwards contacted me. Nobody talked to me. I didn't even know what to use afterwards.
Yeah.
I didn't even know that I shouldn't take a shower.
For hair transplantation.
Absolutely.
No
I have got many patients who thought that it's fine to take showers after the...
Or go
but-
to the beach, just like the one that I saw.
Exactly.
I'm sure that
That's
sure.
true. He doesn't have an aftercare.
the clinic that sold him doesn't have aftercare.
Absolutely. That's what I thought at the same time. I was like, if somebody
Where
has
is your
told him...
aftercare?
Yeah, definitely.
Rania, you are. It appears to everyone, to me, to Omar, to the audience, that you are very passionate about
I really like it.
aftercare, and I would like to close our lovely conversation with an advice from you.
Yeah.
As someone who's not doing the job just for the payroll, but rather someone who's passionate about it, what kind of advice can you give to other aftercare agents who might be watching our video?
Okay, so there are many things to talk about, but the most essential thing that I would rather give as an advice to anybody aspiring to become a good aftercare specialist is to be empathetic, understand the patient, take your time. You don't have to rush it up.
Yeah.
Just have to feel the patient. Put yourself in this situation. That's the key to it. That's the key to understanding everything. Even if you don't have the language, even if you don't understand the mimics or the reactions, there's always a middle ground. There's always someone who would feel comforted by your presence, at least to, be there. Response is really needed in that case.
Phenomenal. Rania, well, I couldn't thank you enough for such a
Thank you
such
so
a
much.
wonderful episode.
Insights.
Amazing insights on aftercare. Thank you so much for joining us and sharing
Thank you
all
for
of
the
this
invite once
information.
I
again.
appreciate your time.
And a huge thanks to our audience for tuning in for today's video. Please stay tuned for more upcoming episodes from insiders to insiders. Don't forget to follow, subscribe, and stay tuned for more videos.